There are a number of different ways in which a person could experience trauma, and most people might be most familiar with people returning from a war setting and experiencing some sort of trauma due to combat, having a life-threatening situation they were in, or witnessing other people in a life-threatening situation or lose their lives. But other types of traumatic incidents can involve anytime someone feels as though their life, their well-being is threatened to a great extent. So other common traumas include assaults. That could be physical assaults, actually sexual assaults. Those are fairly common and one of the most common traumas that lead to the development of PTSD. But there are also other traumas that can occur without other people around. So people getting in a car accident or some sort of natural disaster where they feel their life is threatened may go on to develop PTSD as well. PTSD itself can have a really alienating effect on people, both internally and externally. So people might distance themselves from memories of the event that happened or their feelings that are associated with it, and that often leads to distancing themselves from others and close relationships they may have had. So adding an interpersonal process group to our treatment approach will, as they're getting some symptom reduction, will get them back into practice of being able to connect with others. So we kind of look at it as an added step, and that just because you reduce symptoms, it may not mean that you are getting back in the practice of some healthy behaviors. There'll be a couple of different components of the program. The main part that we'll be trying to work on is trying to reduce any PTSD-related symptoms. But we're also going to focus on not just mental health, but also physical health. So there will be some physical exercise that's included in the program. We will have a portion of the program will be devoted to mindfulness that should be helpful for overall mental health. But most of the program will actually be to reduce symptoms associated with PTSD. We're going to be providing an environment that's going to be supportive, where there's going to be other people there that have PTSD as well, that can provide support to each other, although we won't be encouraging them to discuss their traumas openly with each other. Some of our groups, we feel like will provide them with an environment where they can feel support from people that have experienced similar things. Rogers also has a couple of decades of experience now in trying to design specialized programs that target very specific symptoms for very specific disorders, and has been successful in that manner, and I really feel like has the infrastructure set up to provide a supportive environment for this program to be successful as well. I think some of the unique aspects of the program will also be our ability to deal with some of the conditions that often occur with PTSD. So we have a lot of expertise in other areas of mental health, including depression, other anxiety disorders, personality disorders, and both alcohol and substance dependence and abuse. And so we have a lot of professionals here that we can rely on for support in those areas, and those are the most common conditions that co-occur or develop after someone has PTSD. So I think having that added level of support will separate ourselves from other programs that try to treat this condition as well.